Hello, welcome back to AI Medical School. In this video we will cover what is acid and base, what is pH, acid-base regulation, acid-base disturbance, acidosis, alkalosis, anion gap. So before start the video, please subscribe to the channel and press the like button. Let's start the video. So, what is acid and base? An acid is a substance capable of donating a proton. A base is a substance capable of accepting a free hydrogen ion. What is pH? It is a number expressing the acidity or alkalinity of a solution on a logarithmic scale. pH of a solution is equal to log 10 C, where C is the hydrogen ion concentration in moles per liter. 7 is neutral pH of distilled water. pH less than 7 indicates the solution is acidic. The lesser the pH, the more the acidity of the solution. pH more than 7 indicates the solution is alkaline. The more the pH, the more the alkalinity of the solution. Acid-base regulation. Normal pH of blood is 7.4, but pH varies considerably at different places in a human body. For example, gastric juice is as acidic as about pH 3, whereas pH in the immediate next section of GIT, small intestine, is alkaline. pH is 8. Enzymes, tissues and organs work best at their optimum pH. That's why it is imperative to maintain pH in the normal range. But even a part of normal average daily metabolism, excess acid is formed in the body. That creates disturbance in the acid-base balance. Different physiological regulatory mechanisms that correct the disturbance in acid-base balance are buffer system, respiratory regulation, and renal regulation. Acid-base disturbance, acidosis, alkalosis, metabolic acid-base disorders are caused by primary alterations in ECF, bicarbonate. In response to metabolic acidosis, pulmonary ventilation is increased, which decreases partial pressure of carbon dioxide, and renal net acid excretion is increased. An increase in ECF, bicarbonate, causes metabolic alkalosis. This decreases pulmonary ventilation, which elevates partial pressure of carbon dioxide. Renal net acid excretion is also decreased. Likewise, respiratory acid-base disorder are caused by primary alteration in partial pressure of carbon dioxide. Elevation of partial pressure of carbon dioxide produces respiratory acidosis, and the kidneys respond with an increase in net acid excretion. Conversely, a reduction in partial pressure of carbon dioxide produces respiratory alkalosis, and renal net acid excretion is reduced. Anion gap. The anion gap is the difference in the measured cations and the measured anions. Anion gap is an artificial and calculated measure that is representative of the unmeasured ions in plasma or serum. Ag equals sodium, chlorine, plus bicarbonate. In normal health there are more measurable cations compared to measurable anions in the serum. Therefore, the anion gap is usually positive. Because we know that plasma is electroneutral, we can conclude that the anion gap calculation represents the concentration of unmeasured anions. Normal value, 10 milliequivalents per liter. A high anion gap indicates acidosis. But acidosis does not always mean high anion gap. High anion gap, lactic acidosis, ketoacidosis, diabetic ketoacidosis, alcohol abuse, toxins, ethylene glycol, lactic acid, uremia, methanol, propylene glycol, fenformin, aspirin, cyanide, iron, isoniazid, etc. Renal failure causes high anion gap acidosis by decreased acid excretion and decreased bicarbonate reabsorption. Accumulation of sulfates, phosphates, urate, etc. accounts for the high anion gap. Normal anion gap. In patients with a normal anion gap, the drop in bicarbonate is compensated for almost completely by an increase in chlorine and hence is also known as hyperchloremic acidosis. Gastrointestinal loss of bicarbonate, for example, diarrhea, renal tubular acidosis, ingestions ammonium chloride, hyperalimentation fluids, for example, total parenteral nutrition, mineralocorticoid deficiency, Addison's disease, low anion gap hypoalbuminemia and paraproteinemia.